There once was a young woodcutter a long time ago. He would wake up every morning and go into the forest, and he would cut down the big trees into small logs and deliver them into his home. However, as time passed and as time does, the man grew older, weaker, more slow, aged, scared, afraid, depressed of the world around him. And so, one day when he heads out, and instead of chopping the trees, he grabs his axe and he points the sharp side of it to his chest and says, "I wish for death to take me." "If you insist," says the Grim Reaper, poking out his face behind a tree. The man, startled, drops his axe in disbelief, but instead of running away or trying to beg for his life, he simply asks Death, "Can you help me move the logs?" Death obliges, and when the logs are then moved, the man asks Death, "Why did you help me?" Death retorts, "You asked." In this small story, the man between the literal line of life and death gets the help that he needs. However, the same cannot be said for the millions of Americans who are currently diagnosed with a mental illness, because for them, help doesn't present itself, only death. Because within our country, there exists a blatant stigma and disregard for those who have mental illness. And this illness is increasing suicide rates and increasing the epidemic that we have in this country. However, luckily for us, there is a local organization that's here to help break that stigma. The National Alliance for Mental Illness, better known as NAMI, through their local affiliation here in Champaign County, tries to eliminate the stigma of mental health. They are a U.S. non-for-profit organization full of volunteers that are trying to eliminate that stigma. And I'm happy to say that I've played a small part in that. For the past year or so, I've been peer representative on the Champaign County Board for them, position that I hold dear. On top of this, I am a peer support facilitator for a local support group that I run. All of this to say that we all need help, right? At one point, we have felt lonely, scared, isolated, terrified of the world around us. Maybe we even knew someone that committed suicide, or if you're like me, you survived your own suicide attempt. It's because of this that there needs to be an agent of help. But there is something that is in the way. Because although NAMI wants to help, and they do so by fighting, and I've seen it firsthand, with the free community education, the support groups, and the advocacy, which they all provide, there is some roadblocks. You see, rapidly increasing mental illness diagnoses, a severe lack of knowledge about those diagnoses, and a shortage of local and affordable mental health supports are holding NAMI's punches back when they need to fight back the most. And it's because of these that NAMI can't do their jobs. It's no secret that within our country, we are in a mental health crisis. Our nation is facing the highest rates it's ever seen in its history. And it's because of these rates that these increase in rates that it's making more supports harder to find. According to the National Institute of Health in 2022 alone, there was 59.3 million Americans living with a mental illness. This number is significant, but even more concerning was the number of suicides. According to the CDC in October 2022, 49,000 people in the US committed suicide. Both of these numbers call for a nationwide need for supports immediately and now. However, it's not the only alarming issue that's on the horizon. Another issue is the lack of knowledge about these mental illnesses. These lack of knowledge contributes to the stigma by enforcing negative stereotypes. In December of 2021, a study was published by BMS Psychiatry that found when 477 study participants filed a questionnaire about mental health, the prevalence of poor knowledge and unfavorable attitude towards those mental illnesses was 55.3%. This further increases negative stereotypes, making the diagnosed feel more alone, more isolated, more likely to harm themselves. But let's say for the sake of it, right, that they do find help, that they do find a connection, someone that can help them. Well, therein lies another problem. Because as much as we want to believe that a simple Google search will bring up an 100% free mental health supports, it just won't. Psychiatrists, therapist appointments, they all require money, time, travel, something that people who need help now cannot afford or schedule it later. And it's because of this that these numbers are only increasing. In fact, in a 2018 article, the American Psychological Association author Jessica Conroy found in the U.S. National Survey, people cited many reasons for not receiving needed services in 2018, including cost at 39% and not knowing where to go for those services at 24%. This increases the rates for self-harm or suicide. All of these problems, the increasing diagnosis, the lack of knowledge, and the shortage of mental health supports are increasing the risk of suicide in this country. However, there is a solution. Because NAMI still wants to help. Even with these ever-growing odds, even with the fight continuously being pushed against them, they still provide a plausible light in the dark for those who need help the most. And they provide Champaign, this community, with community education, support groups, and advocacy. In fact, as stated on the NAMI Champaign website, they host monthly comment programs on various topics relevant to the mental health challenges of friends, families, and caregivers. These programs are held conveniently at Champaign Local Library every month and are completely free of charge. Secondly, they run a peer support group at the Illini Union every other Thursday in room 319, supported and facilitated by myself with full 100% confidentiality. Everything stays in that room, and it's only guarded by me and my other co-facilitator. And on top of this, they have numerous legislation, fight for pro things like for mental health, and have numerous tabling events across the United States actively happening 24/7. All of these allow NAMI to fight back, but even then there's still a few roadblocks, a few obstacles preventing them from doing so. The Affordable Care Act, or ACA, is completely under attack. It was supplied as a means to limit insurance companies' control of the products that they have. But if this is cut, insurance companies charge what they want, when they want, how they want. And this can decrease funding overall, funding in which is never guaranteed or never easy to even get in the first place. And according to an NPR article written just weeks ago by reporter Brian Mon, roughly $11.4 billion in COVID-era funding for grants linked to addiction, mental health, and other programs was completely revoked, leaving those who need help desperately drowning in a sea of their own intrusive thoughts. All of these problems contribute to a massive stigma of mental illness. But like the woodcutter and death, this may be the story for some, but it doesn't need to be the story for all, because there's more to that little story. You see, after the woodcutter was met by death, he knew that the second time death came around, it wouldn't be just to help him. So the woodcutter went down to the village and he built fantastic, great big homes. He got the support he needed, the love, the health, the support, everything that he needed, he got. So when death came around the second time, the woodcutter knew that it wasn't going to help him. So the woodcutter goes up to the hill next to him, sits down, looks at the village that he has built, all the things that he has loved, connected, been supported by. He sits down, and death says to him, as he sits down next to him, "To think you wanted to visit me so soon." The man then retorts, "To think all I had to do was ask for help." And you can help with that help. You can donate directly to NAMI.Champaign at NAMIChampaign.org. Every donation counts. We're a nonprofit, little or small. It helps every which way support us, our tabling events, our products, whatever that we can do, you can help as well. And you can discuss mental health. Right now in May, the first day today, is Mental Awareness Month. So you can help out just by talking positively about any of it. And thirdly, you can just check in on that friend or family member that you know needs help, that you know is struggling. A simple phone call can save their lives. All of this to end with a quote by the accountant Itzhak Stern, the late man for Oskar Schindler. He says, "To save one life is to save the world entire." And you can too. Thank you.
When I was 17, I was diagnosed with cancer, acute lymphoblastic leukemia. It is the most common type of cancer in children and is defined by the American Cancer Society as cancer of the early forming blood cells. I was asked by a child once, why? Why did I have cancer? There isn't a why in my case or in the case of all the other children diagnosed with leukemia. It can happen to anyone at any time. We may all be affected by childhood cancer. If not your children, then a friend or a family member. Today, I am here to ask you to volunteer or donate at St. Louis Children's Hospital. This is where I received chemotherapy, and in more ways than one, they saved my life. First, let me tell you how childhood cancer affects the world, then how it affects the child, and how St. Louis Children's Hospital helps you heal in more ways than one. According to the National Cancer Institute, there are 470,000 cases of childhood leukemia every year, with a death rate of 60,000 every year. 60,000 children die of cancer every year. Leukemia is the most common type of childhood cancer, making up 25% of all cases. The highest death rates were in children between 15 to 19, which is how old I was. And I definitely had days where I felt like I was dying. But I was never afraid of cancer because when I was first brought to St. Louis Children's Hospital, I was reassured that everything would be all right. I spent 3 years battling cancer, and I was never afraid of it until I looked up that statistics. I can't say that about most of the other children battling cancer. I know that they were terrified. Living with childhood cancer could be the worst point in a child's life because of the fear of treatment and uncertainty of what is happening. Being diagnosed with cancer, for me at least, was numb. First, I was in denial. It's much like mourning a loss, going through the motions. But I was older than most of the children receiving cancer treatment at St. Louis Children's. I understood what was happening to me. Infusion therapy, or IV therapy, according to Christie Clinic, is used to deliver medication directly to the bloodstream, allowing for rapid absorption and precise dosing. This is how I received chemotherapy. I had what was called a chemo port implanted in my chest, and they accessed it with a comically large needle. And I can't say that I liked that needle, but I know that the little children were petrified of it. I was one of the oldest kids there, but most of the children in the infusion center were young, below 7 or 8, or even as small as 2. I never saw any babies in the infusion center, but I saw several in the inpatient cancer hall. And I can't imagine being their age and going through what I did. I never really allowed myself to cry over my own cancer, but I cried in the infusion center, not for myself, but for all the children around me. We were only divided by curtains, and they would scream and cry, sick and terrified. Being so small, I don't think most of them understood what was happening to them, why they were going through this. And that begins to bleed into you after a while. Even if you're old enough to understand what's happening to you, I couldn't keep myself from feeling what they felt. And I could feel the fear in me now, just thinking about it. This is not the first time that I've been asked to speak about St. Louis Children's Hospital. I spoke at a charity event a few years ago, and they invited 2 other children there at the same time as me. The first was a young girl, much younger than me. She was almost nonverbal and was wheelchair bound due to her brain tumor. And I communicated with her through her mother. And she had so many ambitions, so many dreams of what she wanted to do when she finished with her treatment. She was so bright despite everything that had happened to her. The second child was an infant, so small, and yet they had to move him around in a wagon due to all of the medical equipment that was attached to him. He had a huge scar up the back of his head from all of the brain surgeries he had been through. But his parents were relieved because they were coming out the other side of it all. And I don't know where those families are today, but I know that they were proud to represent St. Louis Children's Hospital. Which leads me to why St. Louis Children's is the best at not only treating cancer, but making you live again. You can get chemotherapy anywhere, but no one shows love, compassion, and care like St. Louis Children's Hospital. Child Life is a program at St. Louis Children's Hospital that helps with the social and emotional stress of dealing with cancer. While doctors physically fight cancer, Child Life helps with the emotional toll. According to St. Louis Children's, Child Life Service Department works with patients and families to develop ways to cope with fear, anxiety, separation from friends and family using play, music, art, recreation, and education techniques. They would often sit with me before a big surgery so I didn't feel so alone, make art with me while I received chemotherapy, and would bring me plushies on long stays. Child Life Service also works with the Duo Dogs, which are probably my favorite thing that St. Louis Children's has to offer. St. Louis Children has over 40 volunteer service dogs in their Duo Dog program. Each of them wears a blue Duo vest and has a matching trading card that you can collect. Most of the dogs come to play and comfort patients on rotation, but Casey, my favorite, is the facility dog and is there almost every day. I don't know what I would have done without Casey. When I became homesick, Casey was there for me. One time a dog came in wearing a sombrero. Another day, a dog tried to steal my sandwich, which they're not supposed to do, but I laugh every time I think about it. Besides the volunteer service dogs, the Purina Family Center allows pets to come visit during long stays. It's the 3rd of its kind in the United States and 4th in the world. Besides the Duo Dogs and Child Life, there's a teen lounge and playroom where patients can go to while they stay inpatient. There's 2 rooftop gardens that look out over St. Louis, and a family center that supports the families and the siblings of children with cancer. There have been over 191,000 children treated by St. Louis Children's Hospital, and it's one of the top-rated children's hospitals in the world. As St. Louis Children's Hospital states, St. Louis Children's Hospital is committed to a mission of doing what's right for kids. That means providing safe care, effective care, and exceptional service to every patient, every family, every day. You can donate to St. Louis Children's on their website, stlouischildrens.org/giving. You hit the Donate Now button and fill out a form and submit. Easy as that. Even if it's $1, everything helps. Your donations help fund cancer research and research for other types of childhood diseases, art therapy, the Teen Lounge, and other child life services. Cancer doesn't always only affect your health. It affects your heart. And St. Louis Children's Hospital knows how to heal both. St. Louis Children's Hospital not only helps you survive cancer, they make you live. And I'm so glad this is where I chose to get treatment. I do not think I would have survived without them.
In 1973, landmark Supreme Court ruling Roe v. Wade makes abortion legal. In 1989, the Supreme Court affirms the right to deny public funding for abortions and prohibits public hospitals from performing abortions. In 2005, Congress passes the Partial Birth Abortion Ban Act, the first law to ban a specific abortion procedure. In 2022, the Supreme Court overturns Roe v. Wade, a landmark case that established a right to an abortion nearly 50 years earlier. These specific landmarks are from women's history and pulled from the U.S. News and World Report, which aim to keep readers informed of the world that exists outside of their own little bubble. And while our reproductive rights are being debated, thousands of women are denied miscarriage care, resulting in bleeding out in their homes and hospitals. Women and children are raped and forced to carry a child the full term. And women find unsafe methods to terminate pregnancy, resulting in death of the woman and fetus. Contentment was never an option. Although not everyone in this room is a woman, I urge you to empathize. Think of your mothers, your grandmas, your aunts, your sisters, your daughters. These are real women that are affected by this every day, and simply ignoring them does way more harm than good. Which is why it is important that I discuss the Center for Reproductive Rights, a charity dedicated to ensuring that reproductive rights are protected under the law. Their vision is to advance these rights as fundamental human rights worldwide. I stand before you with the hope of accurately informing you about the grim reality countless women face each day, and urge you to do your actual care and due diligence by staying informed, or even donating to the Center for Reproductive Rights. I have donated money to this charity because I've seen firsthand the damage that occurs from not having readily available access to reproductive care, and I've also seen that care save lives, including my mother's own. Today, I will address the realities of many women who lack that proper access to reproductive care, as well as those who remain misinformed about this critical issue. I will also discuss how the Center for Reproductive Rights advocates for women's access to this essential care on a daily basis. In hopes, this urges you to investigate this issue on your own and even donate. The issue? Reproductive rights are being taken away and limited by our government and states, and many remain uninformed about the reality of these scenarios. The National Library of Medicine published an article about unsafe abortion published July 22, 2009, which helps conceptualize this. Worldwide, around 42 million women total from unexpected and unintended pregnancies seek out abortions. Around 20 million of these procedures are unsafe, which is the leading cause of maternal mortality, which is death of that pregnant person. We are at an all-time high maternal mortality rate because the lack of these accessibilities we once had more readily available for women. Abortion-related deaths are more frequent in countries with more restrictive abortion laws, 34 deaths per 100,000 childbirths, compared to areas with less restrictive laws, 1 or fewer per 100,000 childbirths. Obviously, there's a pattern and an issue. As I stated, many are just uninformed and are in support of these restrictive states who limit that care and access to proper reproductive care, because they think that they're saving families, children, women, when they're actually doing quite the opposite. The American Journal of Public Health published an article on October 2024 comparing the states who have more restrictions on women's health and who have less, and which states have better access to government programs, assistance for families and mothers, and social services. In our analysis, states with the most severe abortion restrictions have the least comprehensive and least public inclusive infrastructure to support access to reproductive health care and family social services, which is backed up by the Northwestern News, which means they provide the least amount of assistance. And despite pushing for women to have kids, families scrape on by trying to pay for themselves and a kid they can barely afford with this economy of our current status. This isn't even including the fact that they have more restrictions in these more restrictive states placed on families and are unable to get that care and access they want. They have to jump through way more obstacles to get nutrition programs, to get social services, to get any of those programs that are more readily available to these less restrictive areas. And although the reality of these awful situations is tough to hear about, there is a way you can help fight back. And that is by supporting the Center for Reproductive Rights, helping women fight back on a legal level, whether it be donating or just staying informed. The Center of Reproductive Rights was founded in 1992, and since its creation has protected reproductive laws and policies in 65 plus countries and been involved in all major U.S. Supreme Court decisions regarding abortion. This charity has also won groundbreaking cases before national courts. Cases such as the Blackman versus the state of Tennessee. Details were taken from the Tennessee's courts page to discuss the logistics of the case. This case was brought forward on behalf of this charity and on behalf of 7 Tennessee women who were denied proper abortion care. With the charity's support, they were able to deny the Partial Abortion Ban Act and were able to reinstate abortion in this area after ruling that it was unconstitutional to bar these women from getting that care, and doctors were able to perform life-saving procedures on these women. They also had more of their listed achievements on their page. They were also able to reinstate abortion care in North Dakota after they had previously ruled it unconstitutional. Now, I'm not asking you to plan rallies and donate your left kidney. I'm asking you to donate just a few dollars to further this charity full of people who are actively fighting for the reproductive rights of millions of women across the globe. Or even if you can't do that, just remain informed on this prominent issue that will continue to affect women's lives every day. Donating is simple if you must, and if you will. There's a simple button on the page that you can click that will automatically take out $2 each month and will be given to this charity to support their programs. That money goes to fund their legal programs specifically, or it helps them boost other smaller programs that they offer, such as social service programs, proper sex education programs, and medical care, or programs that advocate nationwide on behalf of this charity. If you can't do that, though, staying up to date with what is going on around you brings you one step closer to actively changing the world around you. It all starts with being aware. Ultimately, I hope this dreary reality check serves as your motivation to take action, whether it be to donate to the Center for Reproductive Rights, or just being actively involved and informed about the evolving laws that aim to restrict fundamental human rights concerning women's bodies. Although you may not believe you are actively affected by this, you are, either directly or indirectly. If you take a moment to look around this room, you will see individuals affected by this, women affected by this. You may or may not know their names or recognize their faces, but they exist. So it's time to take action and say something, do something. Contentment was never an option.
In 2024 alone, 3 million people had their homes newly built or improved by Habitat for Humanity. And an additional 5.3 million were trained on how to improve their homes themselves by Habitat. In fact, in our very own Champaign County, we have had 129 total homes newly built by Habitat. Today, I'll be speaking on how you all can give back to the community by supporting Habitat for Humanity. First, I'll be looking at what Habitat for Humanity is and what they do. Next, I will look at how Habitat for Humanity creates stability for people, how they improve communities, and how they break poverty cycles. And then I will look at the ways that you can give back to Habitat for Humanity. Let's see if we can build something here. First, what is Habitat for Humanity and what do they do? Habitat for Humanity was founded in 1976 in Americus, Georgia by Millard and Linda Fuller. It is a nonprofit Christian organization that builds affordable houses for low-income families. The founders of Habitat wanted to eliminate poverty housing while spreading Christian evangelization. The organization gives low-income families modest housing that is built by volunteers using materials that were donated or bought with donated funds. The families are given a long-term, no-interest mortgage, and in return, they put in their own sweat equity, which is work they do on the homes themselves. The organization does this because they believe that the rich and the poor should come together as one to achieve common goals for society. Moreover, the organization does this because they believe in giving people a hand up and not a handout. Now, I can't have a speech about Habitat for Humanity without mentioning their celebrity face, former President Jimmy Carter, who served as the fundraising head of Habitat for Humanity in 1984 and raised $3.5 million for the organization, taking them to the next level as they only had 342 houses built in the 8 years prior to this. This is what has allowed the organization to be as big as it is today. Next, Habitat for Humanity creates stability for people. Habitat CEO Jonathan Reckford, in a lecture given to Harvard University, stated that good housing creates stability. 10 million people, he tells us, die from substandard housing every single year. Moreover, he tells us that poverty, poor health, and poor housing are all interconnected. He goes on to cite an Emory University study that found that kids that lived in Habitat for Humanity homes in Malawi were 44% less likely than their peers to contract diseases. He also cites a University of Tennessee study that shows that children of homeowners are 25% more likely to graduate high school and 116% more likely to graduate college than those who are not. By providing homes, Habitat helps solve issues that are caused by inadequate housing. Next, Habitat for Humanity improves communities. Habitat upgrades property values of entire communities, making them better places to live. Neighborhoods that have gotten run down get a boost from new homes being built by Habitat and existing homes being improved. Additionally, they support other community initiatives like community gardening, community centers, parks, and small businesses. Overall, Habitat helps prevent displacement and supports traditionally marginalized communities. Next, Habitat for Humanity helps people break poverty cycles. Homeownership can be an empowering thing that can help families realize that they are capable of achieving their dreams. Take, for example, Seda Johnson of our very own Champaign, Illinois. Johnson is a mother and longtime bus monitor for Unit 4. When discussing the impact that owning a home will have on her children, she tells us, "I want my kids to see that hard work, dedication, and determination makes dreams possible." Seda says it's important they understand the value of never giving up. Homeownership through Habitat for Humanity has allowed Seda's children to see that their dreams are possible. Additionally, her family has been given a chance to build generational wealth through home equity. Additionally, having a no-interest loan means that people like Seda will not be financially burdened by having a home. Now, what are the ways that you all can give back to Habitat for Humanity? First, I will say there are many different ways to give to this organization. First, the elephant in the room being you can obviously donate money, which is important and will be used to purchase the materials and the land needed to build these homes. You can also donate items to their restore, things like furniture, electronics, and building materials. And they even have a program where if you have an old car you don't use, you're welcome to give to them. All these things are great. But what I would really love to see is the organization's mission of bringing people together to fight for a common cause being put into action. I'd love to see volunteering for Habitat for Humanity. First, volunteering at their restore is a great option. It's located here in town at 1914 Glen Park Drive, Champaign, Illinois, right across the street from Chinooks on Mattis. While this store has a small staff, they are always in need of help. They have many different volunteer options at this store for people of all abilities and all ages. These are things like stocking and pricing merchandise, manning the cash register, providing customer service, cleaning, and more. There really is something for everyone here. Additionally, they have all different times of shifts. They have morning shifts, evening, afternoon. I guarantee there is some time that will work for your schedule. Additionally, you can volunteer at a Habitat for Humanity build site. They have convenient Saturday build times that make for a great productive weekend activity. You can go, spend a few hours volunteering, building homes for people, and go home and enjoy the rest of your weekend. Tasks at the build sites include things like landscaping, framing, siding, insulation, electrical work, drywall, and other basic home repair tasks. Additionally, if you are unable to give materially or of your time, the final way that you can give back to Habitat for Humanity is simply shopping at their restore. It's a great way to get furniture or other home goods at a very affordable price, and all the proceeds go back to a great cause. In conclusion, Habitat for Humanity was founded in 1976 in Americus, Georgia by Millard and Linda Fuller. It is a nonprofit Christian organization that builds and improves houses for low-income people. The homes are built by volunteers using donated materials, and the families get a long-term, no-interest mortgage that they put in their own work for. Additionally, Habitat for Humanity provides people with stability. 10 million people die every year from substandard housing, and Habitat helps address the causes of this. Habitat also improves communities. It upgrades neighborhoods and increases property values by adding new homes and improving existing ones while supporting things like community centers, gardens, and parks. Additionally, Habitat helps break poverty cycles. It empowers people like Seda Johnson and her kids to achieve their dreams while building generational wealth with no interest loans that are not burdening. Finally, there are many ways you can give back to Habitat through donating money, donating items to the Restore, donating cars, volunteering both at the Restore and job site, and shopping at the Restore. Lastly, I want to say thank you to Parkland College and everyone involved with the David Jones speech competition for letting me speak on this charity that is so dear to my heart today.
Imagine waking up every day in pain, pain that never goes away, and a pain that nobody seems to understand. This is the sad reality for over 4 million Americans in the US. According to the Center of Disease Control and Prevention, that's about 2% of the US population. I am one of those 4 million people, and let me tell you from experience, it's not an easy condition to live with. Despite the fact that fibromyalgia affects millions, it is still one of the most misunderstood and misdiagnosed and underfunded conditions there is. But fibromyalgia isn't just about pain. It's about feeling misunderstood and having your struggles dismissed. That's why I'm standing here today asking you all to help make a change. I'm here to convince you to donate to the American Fibromyalgia Syndrome Association, an organization that is not only supporting those living with fibromyalgia, but also pushing for policy changes that are so desperately needed within the healthcare community, that are also needed to help improve their lives. Your support can make a difference, both for those who suffer today and for any who will be diagnosed tomorrow. Donating to the AFSA helps not only to fund vital research, but also to advocate for policy change within the medical field that will give people like me and the millions of others who suffer from this the support and healthcare that they need. Fibromyalgia affects 4 million people in the US, and that's just in the United States alone. Imagine worldwide. Yet it's still so misunderstood. It's a serious chronic condition that causes widespread pain, fatigue, brain fog, and even memory loss. It is known as a neurological condition that makes the brain misunderstand pain, causing it to amplify pain that's not even really there. If you haven't experienced it, it's hard to imagine living with a condition like this. Despite affecting millions, fibromyalgia is often dismissed, misunderstood, or even misdiagnosed for something else entirely. In fact, a 2019 study published in the Journal of Pain Research found that people with fibromyalgia wait an average of 5 years just to be diagnosed, and many are initially told that their symptoms are just psychological. Imagine going to your doctor and being told that your symptoms are just in your head. How would that make you feel? Several sufferers spend years seeking answers only to be told that exact thing, that their pain is in their head, that it's not real. For me, it's not just the pain. It's fatigue, it's the brain fog, it's the constant feeling of being drained. It's frustrating, and honestly, it's quite isolating. I've had doctors tell me, and several other people that I've spoken to that also suffer from this condition, that it's just stress, or I'll get over it. Fibromyalgia isn't something you just get over. It's something that anyone with this illness is going to have to manage every single day for the rest of their lives, because there is no known cure. Once you have it, you can't reverse it, at least not at this point in time. This lack of understanding not only harms patients emotionally, but also delays the treatment that they need. According to 2023 data from the National Institute of Health, fibromyalgia research receives just over $15 million in funding, while conditions like cancer and diabetes receive billions every single year. Research that could help us understand what causes it, how to treat it, and hopefully help us come up with a cure instead gets pushed aside. This lack of funding and understanding makes it so incredibly hard for people like me and everyone else that suffers from this to get the care and support that we deserve. Moreover, fibromyalgia patients face significant barriers in the healthcare systems. Many struggle to find providers who have even heard of this condition, and then when they do, not many of them actually understand what happens. We need policies that prioritize the conditions of fibromyalgia and ensure that those living with it receive the care and the support and the recognition that they deserve. Policies that provide clear guidelines for doctors in the healthcare system to follow for treating patients with this. This is where the American Fibromyalgia Syndrome Association comes in. The AFSA is working every day to raise awareness and fight for those with this illness. And they are fighting for the changes that we need. The AFSA is a leading organization dedicated to improving the lives of fibromyalgia patients through research, advocacy, and better training for those in the medical field. Without their advocacy, fibromyalgia would remain largely invisible in the healthcare community. In addition to policy advocacy, the AFSA provides invaluable educational resources. The AFSA helps educate both patients and those in the medical field who have to deal with this, ensuring that people understand the realities of living with this condition and managing the everyday symptoms. They also provide resources for patients to use to manage their symptoms every day and improve their overall quality of life. Finally, the AFSA offers support by offering support groups that patients can reach out to that provide a safe space for them to reach out and figure out how to go about their daily lives with this condition. Now, you might be wondering, why should you donate? The answer is simple. Donations is what makes everything possible for this foundation. Your support will directly fund critical research into fibromyalgia to find more effective treatments, better understand the root cause of this chronic illness, and hopefully one day find an actual cure. Every dollar you contribute helps the AFSA fund studies that explore the causes, develop new treatment, and work towards that said cure. Every dollar that goes towards research will help improve the quality of life of people who deal with this illness. And it will help them get access to the care, to the resources, to the advocacy that we need just to not suffer. Research is key to improving the outcomes for those living with this condition, and we cannot afford to wait any longer. With more resources, the AFSA can lobby for policy changes at the local, state, and even national levels, ensuring that fibromyalgia patients receive the care and recognition that they need. With your help, the AFSA can continue pushing for better access to health care, increased research funding, and more awareness at both state and national levels. And most importantly, your donations empower people with this. You're not just giving money, you're giving us a voice. You're helping ensure that we're not forgotten or dismissed in the healthcare system. In conclusion, fibromyalgia is not just a condition. It's a daily struggle. It can affect those of us living with it, but also our families, our friends, our communities around us for those who don't see it. It has been long misunderstood, underfunded, and neglected long enough. But with your help, we can make a difference. By donating to the AFSA, you are not just giving money, you are supporting the critical research needed for this, helping change policies, and making a tangible difference in the lives of millions of people who suffer in silence. Together, we can ensure that fibromyalgia is no longer invisible, and that those who suffer from it are recognized, treated, and supported. Today, I'm asking you to take action. Your donation, no matter the size, even if it's just $1, can make a real impact. Let's make sure that fibromyalgia no longer remains in the shadows. Nobody should have to suffer in silence. Let's give fibromyalgia a voice. Thank you.
So when your name is called, we'd love to have you come up. There's a medal, just like in the Olympics, but this is the speaking Olympics, right? So we're going to start with, in 5th place, our winner is Brianna. So. Get 5th here. Do you want to?
Sure. Congratulations, you did fantastic.
Yeah. And our 4th place winner is Pierce.
Get this on you here. Congratulations, you did amazing.
And our 3rd place winner is Quinn. our second place winner is Trinity.
I get it on your hair there, sorry.
All right.
Right, 1, 2, 3.
Okay, thank you. And our first place winner, speaking on behalf of Habitat for Humanity, which will win the $500 donation, is Josiah.
Thank you.
All right, thank you.
Okay. Woo-hoo.
So thank you so much.
Thank you, and thank you to our finalist judges again for your time and effort. Very good. Great contest. You can come back next year, you know.